John Doe is a 65-year-old male with high blood pressure controlled with hydrochlorothiazide, Parkinson's disease, and stage 2 grade B periodontitis. He's taking Sinemet to help control his symptoms of Parkinson's disease. He started smoking a half a pack of cigarettes a day from the age of 15, but he quit at the age of 35. He has noticed bleeding gums during toothbrushing, red and swollen gums, gums that have pulled away from the teeth, and persistent bad breath. He sips on sweet tea throughout the day and experiences some sensitivity to hot and cold, and occasionally a bad taste in his mouth. He has had a cavity, but it was more than 40 years ago. This video will review the proper oral hygiene instructions for a patient that presents with Parkinson's disease like John Doe. So the first thing you might notice when you get a Parkinson's patient into the office is that they have a slow gait, which means that they walk slowly. Their muscles don't work, like they used to. So what you want to do is offer them your arm to take when you're walking back to your op. But obviously if they say no, don't force them. It's totally up to them. And then when you get them back to your op, you don't want to put them all the way supine because Parkinson's patients can have dysphagia, which is difficulty swallowing. And being all the way supine can make it even worse and can cause them to potentially choke. So what you want to do is keep them semi-supine, and that looks like this. So B right there in the image is semi-supine, so they're not fully all the way down, laid back, and they have that slight inclination to their upper body. So the next thing that may be beneficial for a Parkinson's patient is a bite block. For Parkinson's patients, they tend to get muscle rigidity, and this can make it hard to keep their jaw open for extended periods of time. So what the bite block does is you can kind of wedge it in between their maxillary and mandibular teeth, and this allows the patient to have their mouth open but still relaxed. So they don't have to think about holding it open. And a bite block looks like this. So this is that bite block I was talking about. I'm sure most of you have probably used one, but this shows kind of how it fits in between the maxillary and mandibular teeth, so the patient doesn't have to physically keep their mouth open. And this is very beneficial for a patient with Parkinson's, so you definitely want to use one of these. So the next thing you may want to offer your Parkinson's patient is a lead apron. Parkinson's patients have tremors that they can't control, and laying a lead apron on them can help kind of calm that down a little bit, so it can make them a little more comfortable. And another thing is you want longer appointments because Parkinson's patients tend to need more breaks than a regular patient. So you want to, allow time for that. So make sure you have scheduled them for a longer appointment. So the first suggestion you may offer your Parkinson's patient for oral home care is an electric toothbrush. Electric toothbrushes are great because you don't need much of a motion to make them work. You just need to put the toothbrush where it needs to go. You don't have to do the short vibratory stroke. And this can be really helpful for a Parkinson's patient because they struggle with, small movements because they have these tremors. And another suggestion is if they don't have the funds to get an electric toothbrush, is to get a tennis ball and cut a hole in the top and the bottom and put the toothbrush through those holes. And it can kind of make the handle of the toothbrush a lot thicker, so it can allow them to hold it a lot better and control it a lot better. And that's another thing about electric toothbrushes is that they do tend to have thicker handles, so this can make it easier for them to hold. However, they are heavier, so it all depends on what the patient can do. And another suggestion is Parkinson's patients can prop their elbow up on their counter when they're brushing their teeth. This can help if they get tired when they're brushing their teeth, and it can kind of support their arm while they're doing that. Another suggestion may be a stannous fluoride toothpaste, because stannous fluoride helps prevent cavities, it helps prevent sensitivity, and it is working in the mouth for 12 hours, which is very beneficial, especially for a Parkinson's patient that may not be able to brush their teeth twice a day or really struggle with that. So that may be a good suggestion. And another good suggestion may be a chlorhexidine rinse. This would be beneficial because Parkinson's patients are taking some medications to try to help their symptoms, and they tend to cause xerostomia, which is dry mouth. And most mouth rinses have some alcohol in them, and alcohol dries out the mouth as well. But chlorhexidine does not have alcohol in it, so that can help prevent more or worsen xerostomia and still have the antimicrobial activity. Um, Another suggestion is alternative interproximal cleansing aids. Maybe, flossing probably isn't possible anymore, like string floss, but depending on how bad the patient presents, you can kind of judge it and base your suggestion off of that. Um, Also, Parkinson's patients, it's a progressive disease with unfortunately no cure currently, and as it progresses, Parkinson's patients may find it, later down the road, almost impossible to go to the dentist. So you want to suggest any care that they need, such as, getting fillings or any root canals or anything pulled like that to be done while they can go to the dentist, just so they don't have to, hopefully don't have to deal with anything like that while the disease is progressing. So you do want to suggest that. So specifically for John Doe, he has slow movement, muscle stiffness, occasional tremors, and fatigue. So the Parkinson's has not progressed too far because his tremors are only occasional. So I would suggest an electric toothbrush, and then I would probably reassess at another appointment to make sure that it wasn't too heavy for him and it didn't cause too much fatigue. If it did, I would probably suggest the tennis ball trick, putting the toothbrush through the tennis ball. Another suggestion would be, since his tremors are only occasional, you may want to suggest that he flosses at a time of the day that he is not experiencing tremors, just to make sure in that 24-hour period you are flossing to get rid of the bacteria in there. And obviously chlorhexidine and stannous fluoride would also be great suggestions for him. And I would also bring it to his attention about getting the restorations and any type of work like that done before his disease progresses too far and he is unable to sit in a dental chair. So that would definitely be something I would want to bring to his attention, earlier rather than later.